Welcome, everyone. This week is your last lecture for the health portion of this course. My name is Dr. Jerry Vobrel. We've been spending some time together, and this is the last time that we're going to be walking through one of these presentations. Today, I'm meant to talk about the future of COVID. What does that mean moving forward? And when we started developing this course very early in the summer, we were very hopeful that we would already be moving into the future and what does the future look like for COVID. Unfortunately, that is not the case. And recently, we've had to change a little bit for my lecture anyway and focus on what are we looking at right now and how can we make a difference? And then what does that mean for the future? So today we're going to identify the economic impact the global pandemic due to COVID-19 has had on healthcare. We're also going to look at how it's affected our healthcare delivery, how we're seeing physicians and doctors these days, and then we're going to examine the future impact of COVID-19 on our healthcare systems moving forward. We're also going to explore some continuing and future strategies for COVID-19. So, life. How have things changed since 1 year ago? Just think a few seconds about where you were a year ago, what you were doing, and how you thought next year would be. Some of you are freshmen. Perhaps you felt, that you'd be out of college, maybe not even sure which one. You'd be living in a dorm and would have this, wonderful social life. Well, that isn't exactly what happened, is it? And older students, perhaps you're looking forward to the basketball season starting or getting back to the clubs that you've joined. Maybe some of you are performing in a group. Maybe some of you are doing sports. How would that have looked? So again, a year ago, I wouldn't have ever pictured my life the way it is now. What has changed? What are we looking for? Are you communicating more FaceTime with other people on social apps, or are you actually seeing people? I would hazard a guess that we're communicating with our friends much differently. Student life has changed a lot, right? If you just look at these pictures, it would be great for me to be able to teach in a classroom, as that one picture shows. That's very different, right? On campus, everything looks very, very different. And then we have right near the early part of the semester, the students had to move out of the dorms very quickly or be quarantined in the dorm. Quite a few moved out, but quite a few stayed and worked it out in their rooms alone. We also had in the spring, graduation looked very differently. People weren't able to come to campus to graduate. I have noticed over the last couple months on campus that there are people wearing their graduation gowns. They're taking their graduation pictures because they weren't able to do so earlier. And then another huge big change was that we had many, many study abroad groups, and all of them have been canceled. And there's a picture down there of a study abroad group working, with the poor. All of that has really come to an end right now anyway. So we struggle very much to get back to what we're used to. And with COVID around, we don't know what that's going to look like. So let's look at healthcare. Healthcare delivery has changed significantly since COVID hit. COVID has been very negative, both financially and providing care for many patients who are sick because changes in care occurred so quickly. As you learned through the readings this week, the hospital has taken a huge hit. Many of these financial burdens are due to the suspension of routine procedures. And if we remember back to March, when we had that stay-at-home order that went into effect, everything pretty much stopped as we knew it, including our healthcare. People who had surgery scheduled were unable to have them. All the hospitals just pretty much shut down and converted everything over to be ready for all these COVID patients. But because of that order, what did we see happen? We never got the onslaught of patients that we thought we would because everybody was confined to their home, and so the spread was very minimal. Very different than what we're looking at today. So the stoppage back then was for all essential activities, such as going out to restaurants, going to movies, all non-essential, right? All we looked at was essential. So what do we really need? We need food. We need possibly clothing. We need our health care, but limited health care. So the grocery stores stayed open. The Target stayed open because there was things there that people would need, cleaning supplies. The big warehouses stayed open like Costco and Sam's Club, but everything else pretty much stopped. And that was a huge blow to our economic impact. And when this happened, the hospital systems actually did the same thing. So the doctor's offices were closed. Many clinics were closed. Physical therapy was closed. So all of those types of things that we really didn't need that day that weren't an emergency were not happening. Health maintenance appointments didn't happen. So people weren't getting their physicals. They weren't getting their mammograms or their colonoscopies. The well checkups for children weren't happening. A newborn visit would happen, but after that, some of these kids are way off track with their immunizations now because there was such a backup and they weren't opening the hospitals or the clinics, depending on where that child went. We didn't have diagnostics. So even if you were really, really sick, it may take you 3 months to get the test that you need. I know quite a few people that found suspected cancers back during this time in March and April, and they didn't have their diagnoses until June or July unless they were violently ill and they came to the ER. So lots of treatments were delayed. Hospitals also postponed or canceled all the elective procedures. Well, a lot of elective procedures still have a huge impact on somebody's health. Perhaps somebody needs their knee replaced. Somebody needs their hip replaced. Maybe they need back surgery. So all of those things that were not life-threatening were put off. So people were suffering more and more and more. Then on top of it, people didn't go to the ER. ER visits were down significantly because they were afraid to go into a hospital because COVID was everywhere. So things really, really changed and were put on a stop. You guys were all sent home from school. All of those things happened. But during that time, we had a huge economic loss in the healthcare system. And you can look at this chart and you can see the implications of that. I'm not going to go into the specifics of this chart, but it should give you an idea of how many people and how much was lost per 100,000 people. Operating expenses rose over 12% during that time because of all the extra precautions they needed to take, all the pre-testing, all of the extra machinery they needed because of COVID, and the ER visits decreased by 23%. Outpatient visits decreased by 22%, and the hospital admissions also decreased by 8%. So people weren't going to the doctor, they were suffering at home. The resources to run many of these hospitals in these areas, such as radiology, physical therapy, and many other areas, were decreased as administrators needed to redirect their supplies and their resources, meaning the workers, their workforce, to meet the demands of COVID. So if you were a nurse at a clinic, and maybe you've done clinic nursing for 20 years, you then were pulled and you were put in a hospital within that system and you were placed at the bedside. Managers were placed at the bedside. Doctors were taken out of their specialty area and they were now treating COVID. So things really, really changed for everybody. So when you see the reports of this, it's not only that the healthcare workers are overstressed, a lot of them are working outside of their area of practice at that time. And unfortunately, we're seeing that again here in the state of Wisconsin. So at this point in time, I want you to pause and you're going to use your reading guide and click on the article that I have there and you're going to answer a couple questions. When you're finished with that, you can return to the recording. So please hit pause. All right, welcome back. We're going to talk just a little bit about what's going on around us right now, and I'm going to focus on the state of Wisconsin because that data is readily available. So when we look at this graph, we see that the line around here is rising very, very rapidly, and the dates are along the bottom. So way back in the beginning, when we went on shutdown around 322 to 327, we weren't seeing many COVID cases a day. And as I watched this all summer long, I remember being incredibly alarmed the end of July, mid to end of July, when we actually were reporting 1,000 cases a day. Our average had been around 800, 700, even 600 for a very long time. But as we look at the end of September, moving until November 1st, which is what this date has, the black line indicates the average 7-day total. We right now in the state of Wisconsin, today is the 1st, have approximately 4,385 cases per day. That's our rolling 7-day average. So one may say to themselves, what are we going to do about this? What are we going to do? Like, this is scary stuff. Today we have over 228,000 cases in the state of Wisconsin since the beginning of the epidemic, and we have 2,047 deaths in the state of Wisconsin since this began. What's scary about the death rate is that the last 7 days we've averaged 38 deaths per day. So a lot of things aren't always contributed to COVID, but I can tell you from working with the state that the deaths that we're seeing and these cases are contributed to COVID. There's a lot of misinformation out there, but I want you to know that even if somebody had cancer, if they came down with COVID and that the COVID accelerated their death, then that would be considered COVID. Many death certificates have multiple reasons why somebody died. All right. And now we have such a huge emergency in the state that people are really concerned. What are we going to do about this? How are we going to get this knocked back down? So, we have the mask mandates and we can see Marquette's doing great. You guys are wearing them on campus. That's fantastic. But that needs to be transferred over into other areas in the state of Wisconsin. And by the time you see this, the election should be over. Not sure if we know who won yet, but hopefully some of this will calm down. Okay. The other thing that Governor Evers just did is he actually opened up the alternate care facility at State Fair Park. This care facility was built back in April, anticipating that we would have this huge spike. Now the spike has moved down the road. It's now November, and now we're seeing that spike. So they have actually opened that up. So what are the current trends that we're seeing? Well, we had a great visual on that last slide. If you want to go back and look at that, you're more than welcome to. But how can we improve these trends? This is a really, really difficult answer because right now we're not seeing anything going down. So right now, all we know about this is that we need to wear our masks, we need to social distance, and we need to use hand hygiene. We also need to stay away from areas where this is easily spread, which is bars and restaurants, casinos, mass gatherings, even protests. Protesting out, even outside, is putting yourself at risk for developing COVID. Do we need to lock down some areas? Not sure. We're hoping very much so that that doesn't have to happen because of the economic impact, but that may be something that may have to happen in the United States. As we see in Europe right now, I know the UK is starting a lockdown again on Thursday. So it'll be interesting by the time you view this lecture where they're at with that and where we are with that. So what can we do? What do we need to do? We need to do everything that we know already, but we also need to promote that with people that we live with. When you guys go home for Thanksgiving, voice your concerns, stick up for what you've been doing at Marquette. This is a very, very interesting time coming up with the holidays. How are the holidays going to be affected? So think about that a little bit. The other thing that we really need to do is we need to play a part in the contact tracing when somebody is found positive. Contact tracing is very important, and if we can get to contact tracing quickly, we can hopefully shut down a pod of people who are positive. That also includes quarantining when you've been in contact with somebody who is positive. So I'm not going to go into all those details because you did read an article about the importance of contact tracing, but contact tracing is only as good as the people who participate in it. So if you're ever related in a case, and I'm assuming some of you already have, you've been contacted by a caseworker, that you participate as fully as you can in that and as promptly as you can in that. And again, if you are sick, you need to stay away from people, okay? The hospitals now have just announced in the area that we're back to no visitors again. So even though we had started making some progress and moving forward, now there are no visitors allowed in the hospital. So there are things that are starting to happen, backing up from where we came from. What's the future? The future seriously is unknown. The virus won't go away, it's here to stay. Current data shows that antibodies to fight the future infections vary, and they may last only up to 3 months. So the public and you and everyone you know can get COVID again. There are people having repeat infections again. So it's a virus. It's never going to just disappear and miraculously go away. It is something that we're going to have to deal with for the rest of our lives. It's similar to the flu, but as we know, COVID is much more dangerous than the flu, right? So it's really, really important that we stay in tune to what's happening around us and we follow the rules around us. Each area is very, very different in where they are at with how the virus is spreading right now. And we are still waiting for that vaccine to come out. The vaccine is in development in many, many different stages, but we really are unsure as to when the vaccine will come out and what that will look like. The evidence-based articles that I've been reading talk about the vaccine being a two-step process, meaning you get your first vaccine and then you have to come back within a time frame to get your second one. It's also more than likely that this will be an ongoing vaccine that you're going to need to be getting every year, just like we get our flu shots. So still a lot of things unknown out there. The one big puzzle that we're seeing now is something called the long hauler syndrome. And that means that people have gotten sick and it never really resolves itself. It really doesn't go away. I have some students that have this. I have some family members that have this. And they are still 6 months later not able to really think as clearly as they used to. There's 50 things that they've recorded being associated with COVID right now, and then it turns into this long hauler syndrome. So if you're interested in that, you can Google long hauler syndrome. It's very, very interesting. It's very sad. And if you are one of these people, they're now developing support groups for long haulers. They're developing treatment plans for long haulers. And so you're going to be hearing more and more and more about this as time goes on. So to wrap up, as I said, this lecture would be short. As much as this lecture was to examine the future of COVID, it is clear we are still in the middle of this crisis. Unfortunately, things are looking very bad as I'm making this lecture right now. The economic impact is difficult to predict, and only time will tell how we're going to recover from this. It's going to take the healthcare systems many, many years, they're saying, to recover from just that 6 months without business as usual. You are all living in a time that most of us on Earth have never experienced before. COVID just may change the way we live for not only the short term, but quite possibly permanently in some way. So this is a big pandemic that is going to take years to shuffle out, and the medical experts are saying that it may take up to 20 to 30 years to find out what the true impacts of having a case of COVID really are on the human body. So as you wrap up with this, I wish you guys good luck for the rest of the semester. I hope your discussions go well, and I hope that your final papers go well. You're going to proceed right now to the short quiz in D2L. And take care, everyone.